Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we'll be discussing the differences. So let's talk about the differences. And this is the differences between the gastroschisis versus the omphalocele. So what about the gastroschisis? So under the gastroschisis, so here the defect, it lies from 2 to 3 centimeters. So the major points is 2 to 3 centimeters. The sac is, it is never. The gestational age is gastroschisis. It occurs during prematurity, concerned with prematurity. Talking about the umbilical cord, it will be adjacent to the defect. Adjacent to the defect. Next, what will be the herniated viscera? So herniated viscera is that it includes a small bowel, stomach and the colon. So there is presence of the small bowel. There is also presence of the stomach as well as there is a presence of the colon. So is there a malrotation which is occurring? The answer is yes, there is a malrotation which is taking place. So what about the comment on the bowel character? The bowel character is, it is inflammatory as well as it can be edematous. And then the internal nutrition, the enteral nutrition, it is delayed. This is in case of gastroschisis. And what are the associated abnormalities? The associated abnormalities, it is very uncommon. It is uncommon. So let's quickly recap some important points of the gastroschisis. So gastroschisis, we discussed, it is a short, that is 2 to 3 centimeters, and the sac, it is never. And then looking at the gastric age, it presents in prematurity. Umbilical cord, it is adjacent to the defect. So it is adjacent to the defect. Then talking about the herniated viscera, again it's a small bowel, stomach and the colon. The malrotation, yes, it is present. The bowel character is, it is inflammatory. This is important. In gastroschisis, it is inflammatory and the edematous. The enteral nutrition is delayed. So bowel character is inflammatory and the edematous. Enteral nutrition delayed. And what about the associated abnormalities? This is not common. Now we move on to the omphalocele. So here in omphalocele, the defect size, it is about 2 to 15 centimeters, and the sac is, it is always or maybe ruptured. So sac, if you see, it is always or it may be ruptured. So it may be ruptured. Next, talking about the gestational age, it occurs in the term, and umbilical cord is attached to sac. It is attached to the sac. Next is, what about the herniated viscera? So herniated viscera. So herniated viscera is small bowel, stomach, colon and the liver as well. And malrotation, yes, the MR is present, rotation is present. The bowel character and the enteral nutrition is normal. Whereas in case of gastroschisis, we saw it is inflammatory and it was edematous, and the enteral nutrition, it was delayed. Whereas the bowel character and the enteral nutrition, here it is nothing but it is N, that is normal. And what about the associated abnormalities? Associated abnormalities being very common. So now let's quickly recap what we did in omphalocele. So omphalocele, the defect size, that is in diameter, it is slightly bigger, that is 2 to 15 centimeters. So gestational age, it is concerned with term, and the sac is it always may be, or it always, and it may be ruptured. It may be ruptured. Next is the umbilical cord is attached to a sac. The herniated viscera, the small bowel, the stomach and the liver. Malrotation, yes. Important being the bowel and the enteral nutrition. So these two remain normal. But what we saw in gastroschisis, it was there is inflammatory and edematous, and the enteral nutrition was delayed. Next is the associated abnormalities. This is common. So associated abnormalities, it is very common. in case of the omphalocele. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.